My name is Dr. Lee Chee Kuan. I'm a consultant orthopedic surgeon at ParkCity Medical Centre. I did my subspecialty training in Australia, where they put us in the term of lower limb surgeon. So in Malaysia, we are known more as an arthroplasty surgeon. So arthroplasty means you are involved with joint replacement. And the two main joints that I do a lot replacement will be the knee joint as well as the hip joint. So orthopedic, besides fixing the fracture bones, we also try to get back the function of this patient and getting back the patient walk back using their hand, their limbs is something that inspires me to help them more and more. Knee joint replacement or called total knee replacement is more common in Malaysia as well as the Asian country, and we've been doing this for a lot of patients, and a lot of patients who have done this operation, they have found pain relief, better function, and they're happy with this. Alright, like in all operations, we first have to tell the patient the benefit of the surgery, which is usually in terms of pain management and functional restoration. And we also tell them what are the risks that involve, which are mainly the infection risk, bleeding risk, injury to the nerve and vessel and the surrounding structure. And for the joints, stiffness is very important. They need to undergo physiotherapy. And another common complication can happen in all the major operations will be deep vein thrombosis, DVT. Now we have to really tell patients, describe to them in detail what are all these risk involvement and what's the percentage. And in order for them to understand, occasionally we need to show them graph, show them picture, show them previous patients who have done the surgery, and this will help them to make a decision. Another thing that we need to overcome with all this patient is the fear, because all of them are very feared. Mainly the elderly people, they have arthritis of the knee, and they are usually in the age group of 60 and above. So fear factor is one of the most important things. We need to really tell them the safety of the operation. Explain to them, especially the cardiac risk. Because doing the operation of a knee replacement and hip replacement is quite straightforward, but the cardiac risk is very important. It needs to be addressed, and I usually have my colleague, the cardiologist, to help me in checking their heart, make sure it's in the best position, optimize it for them to do this operation. Besides the cardiac, the post-operative pain management. For our operation, they'll be fearful of pain after operation. Yes, it's true, it'll be painful after operation. So for that, we need to have good post-op pain relief, which I get help from my anesthetic team, especially the pain specialists. So they have different type of modality to help you control the pain, ranging from epidural to PCA, all these things. And then the next one, more important, is rehab. Rehab is to get back the function. So again, this patient, they always ask question, doctor, after the operation, can I walk or not? So this is the most common question they ask. I say, you can walk, but you need to do proper physiotherapy. So the patient need to come to get proper physiotherapy, then the team there is to help them to guide them. So overall, the fear factor is the one that patient having when they want to come and do any operation in any hospital. And it's our duty to specify them, to tell them what the benefit you're having, what the risk you're having, you'll get it, and what are the countermeasures we have to relieve them from all these complications. To all my patients out there and everyone who's listening to this video, I would like to tell you something about joint care, especially the knee joint. So knee joint is one of the biggest joints in the body and can easily get injured. So the knee joint stability is mainly given by the ligaments around there and the muscle. So taking care of the ligament and the muscle is the utmost important. Therefore, proper exercise, proper physiotherapy is very important, and avoid injured it. So when you want to get into games, especially like football, futsal, badminton, which you use a lot of jumping, running, all these things, you need to have proper warming up of the joint before you start it, and proper cooling down the joint after the games. And in the meantime, while playing the games, has a knee protection. Because once the knee is injured in the young age, when you torn some ligaments, like meniscus or cruciate ligament, the problem of this can be bringing forward until you're in your old, where you will develop osteoarthritis at an earlier stage and more advanced stage. Therefore, care of the knee should start early, not late. Because at the end of the day, when your knee is degenerative, or we call osteoarthritis of the knee, the only one option treatment, that is a knee replacement surgery. Like what I have here, a knee replacement surgery. This is the final operation for most of the knee problem. Well, you can solve the knee problem, but if we can avoid this operation, we try to avoid it. But we can't avoid, this is the final solution that you have. So take care of your knee, because having a painful knee is very miserable. So it won't kill you, but you're a miserable life. So take care of your knee. All right.